We are live. Tonight, guys, is going to be a fun show. Just putting it out there. So, guys, raise your glasses. Raise what you got there, Dr. B.
Ooh, I went fancy tonight.
You went fancy with the period.
Non-alcoholic.
Non-alcoholic. Well, that's still
Non-alcoholic.
fun. That's still fun.
May not be that way for long.
Come
but-
on now. Come on now. All right, guys. I am going to wait for a few minutes and wait for you guys to jump on board. A couple people starting to jump on board. So guys, as you jump on board, you know that my audio and my mic love to mess around with me because I have gremlins that live in my computer. So if you guys can just throw it in the comments section, whether or not you can hear me, whether you want to stop hearing me, whatever you want to put, or more importantly, tell me who you are, where you're from, and what's in your coffee mug this evening. Don't be shy. All right, guys, as you can see, I have a very special guest in the house. And if you saw my latest Bob comic, you're going to have a hint as to who he is and what we're going to be talking about tonight. Hey, Tanya. We've got Tanya here from Arizona. We've got Tom. Oh, there you are. There's my Texan right there. We've got Kay from Alaska. Yeah. We've got Kay from Alaska. There's my occupational therapist. So we've got a lot of clinicians that jump on board, which I always love that. Willie Mae is there from Richmond, Virginia. All right, guys. I see many of you popping on board. I'm going to give you a couple more to get there. Hey, Brett, there you go with your iced tea in Kansas. You can hear me. Awesome, guys. I am so glad because, we had a little blip with the microphone earlier, but we're all good now. Hey, Debbie, there's my Floridian Debbie. You are really going to want to listen in tonight. Let's see. We've got Daniel on board. Hey, Bonnie. Oh, Bonnie, how are you doing? Send me an update. If you don't want to post it here, send me an update. How are you doing? Doug is back home from vacation. Good to see you too. But Doug, I'm so glad you could join us this evening. All right, guys, we are getting a lot of people popping on board real quick. So guys, also as a housekeeping note, I am also broadcasting from my YouTube channel tonight. So for those of you who don't like Facebook, who know of somebody who is not on Facebook but would like to listen to the show, everything is under Cosi Talks. It's super easy to find. So you can also watch me from the YouTube channel. Hey there, Devin. We've got Jeannie. Jeannie, I haven't seen you in a long time, girl. We got Leanne. Oh, Leanne, that's my girl from California. Happy Wednesday, Robin. There is my beloved social worker. Chuck listening in from the YouTube channel. Oh my gosh, thank you guys for showing up. Here we got Carrie and Daniel Waters. You may have to watch later. That's why God invented the replay, Daniel. So guys, those of you watching my replay, please post that in the comments section. I always look back on the shows to see if there's any new questions coming in, and I always look for a replay. That's what lets me know it's a new comment. Hey, Patrick, there's my other physical therapist right there. Mark S., what's up? All right, guys, we have got a great group, so we're going to go ahead and get started officially. For those of you watching for the first time, welcome. My name is Cosi Belloso. I'm a physical therapist, amputee specialist here in Tampa, Florida, and with me, I pointed in the right direction, is Dr. Ricardo Berrios. I don't get to roll my R's enough nowadays. So I'm going to let Dr. Berrios introduce himself. He is a board-certified dermatologist. Take it away.
Hey, Cosi. Hey, guys. It's great to see so many people hopping on already. This is going to be great. Thank you again so much for having me. As Cosi said, I'm a private practice dermatologist practicing in the Tampa area. We have 4 locations across the Tampa area. And I do a little bit of everything, but I specialize mainly in surgery. And I also do a lot of complex medical dermatology. So basically the stuff that nobody else wants, the crazy rashes, the crazy ulcers, the crazy stuff. As we'll talk about more later on in the presentation, that's what I grew up loving. Part of my training, which I did up in Loyola in Chicago, was working 3 years at the Hines VA. So one of the things that the Hines VA really does a good job at is wound care, amputee care. And so we had a chance to participate in an interdisciplinary team on that. So that was huge part of our training, and it's a huge passion of mine. And so when Cosi said this, I said, absolutely yes. I can't wait to jump in again. So before Chicago came medical school, which was at Emory in Atlanta, right next to the CDC. So it's fun to see a lot of my professors up on CNN and stuff these days. It's good to have a connection there. And then before that, Tampa's home. So I was went to undergrad at USF. Go Bulls. And then did high school in the Bay Area as well. I'm a King Lion, as they say. And so yeah. So it's been a long journey. It's been a fun one. It's crazy to think that I'm 7 years now into private practice, and it's been extraordinarily rewarding. I'm sure, as many of the providers on can tell you, I'm sure as Cosi can tell you, this is fun. We do this because we love it and we love to impact lives. And to be able to do this in a new venue, in a new way through this type of presentation, I can't thank you guys enough.
Oh, I told you guys I got a good one for you tonight, right? And guys, I do have to take this time to thank my generous sponsor, Vital Fit. Obviously, as you can probably tell by the topic of tonight's show, everything about skin and everything that can affect your skin, Vital Fit was going to be my sponsor. It's been a very rough year for a lot of folks with COVID, everything affecting businesses, big businesses, small businesses. And I am one of those small businesses. So I depend on the generosity of my sponsors. And Vital Fit has stepped up to the plate for quite some time now. And on top of allowing us to do this show this evening with Dr. Berrios, we've got some free giveaways. So all of my quick draw McGraws with the keyboards, get ready because we're going to have some nice giveaways for you guys tonight. And we've got, let's see. Oh, Daniel started his physical therapy classes. Patty from New York is on board. Adam, I am so glad you made it. Thank you for making it, Adam. Let's see. We've got Tom says, thank you, Ricardo. Jeannie from Illinois. We've got Joan. Oh, there's my Aloha girl. There we go. We got Grant from Salt Lake City. Benjamin, dude, we have got a great house tonight. So guys, the purpose of tonight's talk is skin. Any of you who have listened to any of my shows will have heard me say that to be successful with wearing your prosthesis, you have to have happy, healthy skin. If your skin is not healthy, it doesn't matter how fancy that microprocessor knee is, you are not going to be going anywhere. And there's a lot of things that can happen with your skin. In our pre-interview, our pre-interview went for an hour and a half just on everything that we were talking about. So guys, we're going to be talking about a few tight subjects, things that most commonly occur. I know many of the things that I see in my own clinic, and I know Dr. Berrios treats these things with his eyes closed that we're going to be talking about tonight, and how you can identify some of these things, treat some of them, and more importantly, know when to go see your doctor. Right? All right. So guys, let's talk a little bit. We got to get the boring stats out of the way because this is also going to help you understand the whys behind the skin. We're going to do a quick Cosi poll. Guys, how many of you, hey, Leslie, how many of you lost your limb due to either diabetes or vascular complications? Put it in the comments section. Okay. This is the Jeopardy. I usually have my Jeopardy theme song playing right now, but you know.
I can hum it.
You can hum it? Okay, that'd be kind of cool. And he's in tune.
All right, that's it. Done.
All right, that's all we're getting.
American Idol, here I come. Give me the golden ticket.
The statistics here. So Grant lost his, Sharon to vascular. We're starting to get some of these answers rolling in. The statistics will say, guys, that about 54% of folks lost their limb due to vascular issues. Trauma accounting for 45%, and then a smaller percentage with cancer. Okay. Such a talented guest. There we go. So Carrie lost hers with vascular issues. Megan vascular. Stacy is humming with you, Dr. Berrios. We've got Jeannie with trauma. Johnny, hey, there's Johnny. All right, guys. So, obviously vascular and diabetes play a huge role. So what happens? What causes the body to lose a limb because of uncontrolled diabetes, for example? Okay. So guys, when the glucose is not under control in the system, it starts to affect the arteries and the veins, right? So think of your veins as this nice like spaghetti, not quite al dente, just kind of moving spaghetti, okay? As the glucose starts to go out of control, okay, that nice fluid spaghetti starts to become a little bit more stiff, right? And it's not quite as juicy and rubbery as it used to be. And this is where we have issues with circulation being compromised within, okay? So two things can happen. Someone can get a small cut on their skin, and because the circulation is not good, that cut turns into a big festering wound. Or the opposite. Someone can get a bump on their skin, not necessarily break the skin, but cause an internal wound that they don't know about until that wound grows and basically erupts, okay? So this is usually how things end up happening. And here's the caveat. Many times people say, well, how did this wound get out of hand? Because people lose sensation, right? They'll lose sensation in their foot, in their lower leg because of the diabetes, because of neuropathy, even with vascular issues, and they don't notice that something is brewing there until it's too late, okay? All right, guys. So Jeffrey was a trauma accident, but later became a diabetic. Yeah, and it is kind of scary, Debbie. It is kind of scary, okay? So guys, when a person has an amputation due to vascular disease and diabetes, one of the things I tell my patients is, you still have the diabetes, right? You still have the vascular issues. Those did not get amputated with your leg, okay, which means that they can still possibly cause more damage in your body, right? So there's two ways to make sure that your skin stays healthy during this time, to make sure to help prevent a second amputation. And that's taking care of yourself from the inside and from the out, right? So guys, taking care of yourself from the inside, controlling the diabetes, okay? Following to the letter, whatever it is that your doctor, your surgeon is telling you to do to control that pathology. And from the outside, this is where we come in, right? We can keep that skin nice and healthy. Sounds good? We're good? Am I correct on everything, Doc? We're good?
So far, excellent.
So guys, we're going to go ahead and start with our very first giveaway because I just like having giveaways. You guys ready for the giveaway? All right, here we go. I am going to post the link. Y'all are familiar with my giveaways, many of you. Okay, link is posted. All right, guys, ready? This is going to be for a travel size of the 4-part series for Vital Fit. That's going to include the cleanser, the daily moisturizer, the liquid to powder lotion, and the nighttime moisturizer. These are my favorite products to give my patients, guys, for skincare. Go to this link and tell me the color of the shorts the model is wearing. Go. I really need to get background music. I really do. That's going to be my budget for next year.
Yeah. You got Jeopardy music out of me. I'm a 1X show. Sorry.
Yeah, well, you apparently now have some new. There we go, Jeannie. Very good, Jeannie. Yeah, I told you we have some quick draw McGraws. Adam, you are a close second. So, Jeannie, that is correct. They are yellow shorts. And guys, the reason why I'm pointing you to this particular section on the website for Vital Fit, they have a beautiful blog. Okay, they have, and I may have guest written one of the blogs, so I'm just kind of tooting my own horn there right now. But they have some amazing articles on there, guys, with how to care for your skin, how to deal with sweat, how to manage sockets. There's a lot of great information on this blog. So I would encourage you to just kind of scroll through and pick out one of the articles to read through. Benjamin, it's not orange. Ray says blue and black. Really? Go figure. It's my guys who are colorblind. Really?
Hey, it's my disability, colorblind. Hey, it's a real thing.
Something with that Y chromosome. Anyway.
Yeah.
All right, so I've been talking way too much. I need to let my guest speaker do his thing, which it's going to be amazing. Talk to us about the physiology behind sweat.
Yeah. Thank you, Cosi. Yeah. So sweat is so fascinating to me. It's one of the things, not only because we live in Florida, but I mean, it's one of the things that I deal with so often. It is behind such common complaints as a sticky feeling to the skin, a smelly odor to the skin, a discoloration. I mean, we get all kinds of different complaints, and it's all related to sweat. And one of the things that I remember seeing, when I was seeing amputee patients, is exactly that. Cosi and I shared a common experience where it's like after an exercise or something, you have a vet comes in and they just, tip over a thing and it's full of sweat. And when sweat causes all these problems, it's because of what's inside the sweat. A lot of people think that sweat is just water. It is not. It is a very complex mixture of things. There's salts, there are sugars, there are proteins inside the sweat that all have very unique function. Obviously, we know sweat is to control our body temperature, but when it extrudes something, there's also antibacterial properties there. It's keeping our skin nice and healthy. But sometimes, especially when it's in a trapped environment, the bacteria that are already on the skin start to take those sugars and those proteins and they metabolize them. And when bacteria metabolize things, they tend to release gases that don't smell so good. So that's where the odor comes from. The odor doesn't come from the sweat per se. It comes from the bacteria metabolizing the things that are on the sweat. So oftentimes when I see patients complaining of odor and things, I said, we've got to actually control the sweat. If we control the sweat, then the odor goes away. And I'm sure we're going to talk about more about that in just a little bit.
Oh, yeah. Yeah. And guys, if you see me going like this a lot of times during tonight, it's because he is echoing a lot of the things that you will hear me saying. And I think it's just nice when you have hearing it from somebody else. Okay. Because I know I can sound like a broken record sometimes. So, one of the analogies that I give is to my newer patients is when they ask me, well, my skin was perfectly fine prior to the amputation. Maybe they didn't have diabetes, or maybe they have good looking skin. Why do I need to care for my skin? And I say to them, well, prior to your amputation, your skin was open to air all day. Even if you were wearing pants, right? Your skin was airing out all day, right? And now you have a liner, socks, and a prosthesis. So it's the equivalent of basically tying a garbage bag over your leg and cinching it tight. And especially here in hot, sticky, humid Florida, right? That can become miserable. Van Gregory just said bacteria farts. And I just said that on my show.
Van Gregory, if that's trademark, if it's not trademark, can I take that? That's actually very good. I'm going to take that.
See, my sponsors are sitting there going, oh gosh, this is what happens when we get Cosi free reign. This is when we allow her to take off with things right now. Guys, I'm so sorry. Okay. So anyways, kind of getting back to it, guys. It's wearing a garbage bag on your leg all day. All that sweat and moisture gets trapped there. So your skin that was previously maybe nice and healthy and didn't have so many issues, you're going to start to get issues. Even for my young folks, a lot of times my 20-year-olds will come in and they got this nice rubbery young skin and it's all nice and pretty. And they're saying, I don't have to do anything for my skin, right? And then they go out and they spend 14 hours in a socket, and now all of a sudden they're starting to get heat rash. They're starting to get a possible fungal infection, okay? So it's important to understand the why behind it. And Dr. Berrios explained it beautifully with the physiology behind the sweat, okay? Yeah. So guys, while we cannot completely get rid of sweat, we can learn how to manage it. And one of these is the products that I use on my patients that we're going to talk about in a little bit. In the meantime, we're going to talk a little bit about some of the problems that can start occurring, okay, when you have too much sweat, when you have friction and shearing within the socket because of sweat and because of these issues. All right, so let's talk a little bit about blisters and calluses. That's probably the number one most common thing that I will see in my patients with their skin. Another Cosi poll. How many of you have gotten a blister or a callus while wearing a prosthesis?
Be honest.
Let's go. That comment section should be lighting up like a Christmas tree in a couple minutes after the time delay, of course. So Dr. Berrios, how did you approach telling your patients how to deal with the blisters and calluses?
Yeah. So this is another super common thing that we used to manage and do manage nowadays. Here's how I like to think about it. Blisters and calluses are your skin's warning red light blinking, something's wrong. I mean, we've heard the expression, rubbing me the wrong way. That's exactly what this is. Sorry to be cheeky, but it's true. It is so true. Who knows? Maybe that came from some dermatologist somewhere. But a blister or friction or a callus is the skin's response to constant friction, rubbing. That's not supposed to be there. Mm-hmm. So when we would see this, it's sometimes it's hard for us to tell amputees is that they have to go back to their prosthetist, but that's actually true. You have to. I've got a hot spot, right? This blister that's starting to form here. That's usually the first sign. It's the first sign, the blister first one, and then eventually with persistent rubbing, the skin forms a process called lichenification. Lichenification is a fine, fancy, derm word for layer upon layer upon layer of the skin. And it's because the skin isn't stupid. It's not dumb. It's the normal physiologic response. It's got to protect itself. And it's going to do that by thickening. So start off as a blister and then eventually forms the callus. That tells me that it's an ill-fitting prosthesis. Something is rubbing here wrong.
See, it's another one of those Cosi moments.
It's another one of those moments.
And I'm going to interject here, guys. When we were doing our pre-interview, Dr. Berrios is all, polite and a little he's like, I might not be very popular when I say this, but if they have a blister or callus, it's because something's going on with their socket and they need to get it taken care of. Yes? Okay. Yes. Hopefully some of you are also yelling at your computer going, yup. Okay. Guys, it's the hallmark sign. It's exactly what he said. Your skin is telling you something is wrong. It could be something as simple as you need to learn how to adjust how many socks you put on or off. It could be as simple as your liner is getting too stretched out, which means you have room and there's friction and rubbing, which there should not be with your liners. Or it could be that there is something in the actual socket itself with the alignment that is causing pressure. For example, in my above the knee amputees, Many of you will get what we call distal femoral pressure. It's that pressure on the bottom part of your femur on the outside, right? And at this point, you're either hopefully working with a physical therapist who can teach you how to adjust the socks, who can identify the problem. And if you don't happen to have a physical therapist, then taking it to your prosthetist to troubleshoot. Because guess what, guys? Once that blister heals and you put the prosthesis back on and you haven't fixed the problem, it's going to come back again. Okay.
Yeah.
And guys,
Absolutely
back in
right.
the 60s and the 70s and maybe even early 80s, blisters and calluses were an accepted, obstacle and accepted byproduct of wearing a prosthesis. But nowadays, there is no excuse for it. There's no excuse for it, right? So what are some of the ways that you teach folks who come in, for example, with a blister or a callus, how to manage it properly, Dr. Berrios?
Yeah, no, thank you for that again. So the first thing is, do we have a prosthetist that we're working with closely? I believe truly, I believe in interdisciplinary care. I'm not here to save the day. I don't know everything about prosthetics. So make sure that the patient has a working relationship, somebody that I can work with. I am certainly not about picking up the phone, calling, be like, hey guys, we really got to work this through. But in the short term, you have to figure out a way to create a barrier. So one thing I really like are tegaderms. Cosi, you know what those are. I don't know if the community knows. These are kind of like those. They look like waterproof Band-Aids kind of a thing. It's a very thin, almost like sticky cellophane looking thing. So that's a very easy one. If it's already starting to break through the skin, sometimes I'll go with Duoderm, a thick Duoderm. That's another excellent way to create a barrier. It's also semi-absorbent, and boy, does it stick for a long time. So it's also durable. So as a short-term Band-Aid situation or solution, that's what I'll do. I'll do a tegaderm if it's not too advanced, a thick Duoderm between when they see me and when they can see their prosthetist again.
Absolutely. And then guys, here's the thing, and I don't know how you guide your patients, but when my patients have a blister that's newly healed, it'll be a slightly paler pink color, or depending on the person's skin color, it'll be just a little bit different. And it's basically the skin kind of remodeling, right? And building itself back up again. So that is the time for me that I'm really watching this person's prosthesis, because if that thing lights up again, right, then it's game over and we got to take a break from the prosthesis again while it heals. Okay. So even if your prosthetist fixed whatever problem it was, that little patch of skin is going to be a bit more sensitive. So you have to keep an eye on it. In my case, I usually tell the people like a liquid to powder lotion, right? Put a little bit on it once the skin is closed, right? Put a little bit on it to help with that friction and shearing for that little hot spot right there. All right, let's see. We got lots of comments rolling in. Lori says, I've only ever had a blister from an elevated vacuum system, never from my regular sockets. And that is something about the elevated vacuum systems, is if you get too aggressive with the vacuuming, you're going to basically suck a blister out. So you have to be very careful about that. Tom's my bilateral AK, who says, deal with it was the motto from the 70s, 80s.
That's so true.
I know. Johnny uses the tegaderm. Patrick says, would you change wearing schedule with a blister? Yes. So Patrick, if it's somebody that it's their first blister because they were careless and it healed up nicely, there's no other underlying skin problems, I'm not going to be as aggressive. But if it's somebody who has very delicate skin, my diabetics, especially if I'm the sound leg, I'm seeing the effects of diabetes with that brawny skin, then I do put my patients on a strict wearing schedule where I'll pull back and I'll say, okay, looks like you're starting to pink up at the 10-minute mark. So I want you wearing it for 9 minutes, and I will have my patients set a clock. And again, this is for my more sensitive patients with their skin, because I want to protect that skin. Okay.
Yeah, no, absolutely, Cosi. I mean, I'm sure you can agree with this. Early intervention is key. Really educating patients to recognize those hot spots early and getting in. With an ounce of prevention is worth a pound of cure, right?
Yes.
It's much more life impacting to have to deal with an ulcer than it is just a little early sign of redness or erythema, which is what our fancy word for redness.
Yeah.
But getting in early, recognizing those hotspots is so important.
Yep. And then we have a question here. Ray asks, when going to work, how can you address the issue? And again, that's the tricky part, because obviously, depending on the nature of your job, you've got to be able to move around and pick back up again. So again, this is where the help of a dermatologist is really wonderful, or a therapist who knows a little bit about wound care, and providing you with something like a tegaderm or a duoderm, something that can really protect you while you're in the socket at work. And then again, you know your own body. You are the one who knows yourself the best. If you know that after an hour, that little hot spot's going to start pinging off on you. Then you need to do a quick removal, check it to make sure it's okay, change anything, clean anything that you might need to do before you get back to work. Okay. And if you think about it, guys, it's annoying, yes, but the longer you have these skin issues keep popping up, the more time you're going to have to take away from work. And sometimes, and I've had to, put this in a medical note for some of my patients so that they can take it back to their supervisors, explaining to them, this is why. I'm probably my 5th patient ever with amputees. It was this gentleman, and I kid you not, he had 11 blisters and they were all open. And he would refuse to stop wearing his leg. He just refused. He said, I have to work, I have to work, I have to work. And the poor guy ended up being out of work for 3 months because the doctor finally took the leg away because they were starting to become infected.
Yeah.
So guys, that's an extreme case, but we don't want to take it there. So Dr. Berrios, what kind of advice do you give for folks trying to get back to work with this scenario?
Oh, absolutely. I mean, I think you have to work a very close working relationship with your providers and be honest and tell them, what are the demands that you need. And we are more than willing, I think, to help you out any way that we can, writing a note, helping with, FMLA paperwork, whatever the case may be, giving you the time you need. Because absolutely, we'd rather catch it early and address it early than to have to deal with the complications later on. Frequent changes is between, you noticing something and getting in with a provider, whatever attention you need to give it with a Tegaderm or a Duoderm is a nice kind of patchwork approach until you get in. So as often as is necessary, just let us know, be honest up front with us. Hey doc, listen, I need to be off the floor, every 30 minutes, I've got a hot spot or something, what can you do for us? Let us know and we'll more than happy to do it. And I will say, Cosi, one thing that we talked about, I know in our pre-interview, is knowing when to get into the doctor is very important. Not every blister is due to friction.
Oh, okay.
Did you like that segue? Saw what I did there?
Hear it. I like that. Let's hear it. Let's hear it.
So, and this is where it takes the finesse of the patient understanding their own body, like you said earlier, but also getting into a provider. Blisters can happen certainly due to friction, but especially if there are some other symptoms associated with it, I have to start asking, is there an irritation going on here from some sort of overuse of a chemical potentially? Has the patient developed an allergic reaction to something? That certainly happens. Is there potentially an infection that I'm dealing with? I've seen, Cosi, you can probably jump in here. We've seen herpetic infections, which is a virus that can affect a limb. It can affect anywhere. Bacterial, fungal infections, anything can happen. Usually a friction blister, you can recognize it. It's got that little bit of soreness to it. The other ones, you've got some other symptoms. An irritant dermatitis, for example, which is basically just a fancy word for inflammation of the skin due to something that the skin doesn't like. You'll have burning. You'll have some sort of like discomfort, almost like a pain. Versus an allergic contact dermatitis, which is where the skin is actually truly allergic to something, then that's almost always itchy. I tell patients, I have never seen an allergic contact dermatitis that is not itchy, right? If you've got itching, that's a signal. Another clue that we use is the character of the blister. Usually a friction blister is a decent size, single, most of the time, and clear filled. An allergic contact dermatitis tends to be little ones, little tiny blisters that are clear filled. An irritant dermatitis may or may not have blisters. It depends on the cause. And then bacterial, fungal, they tend to have pus filled. So looking real closely and having a fine eye for the nature of the blister is really, really important. And that's where a dermatologist comes in. We don't just inject Botox and pop pimples all day, despite what TV says. One of the great blessings of being a dermatologist is a well-trained eye. You can walk in the room, look at something, quickly make a diagnosis, and be like, "This is what it is." So it's hard to replace. So getting in with a provider who knows what they're looking at is super, super important.
Yes.
And I know one thing we were talking about earlier is, how many irritant reactions do we see? What are my odds that I'm allergic to something? Well, if you look at all contact dermatitis across the board, about 80% are irritants, and 20% are allergic contact dermatitis. Irritants, like I said, the way I explain it to patients is irritants are things that are going to irritate all of us if we're exposed to enough of it. Kind of a crazy extreme example I say is we are all irritated by hydrochloric acid, right? If you dip your hand in acid, it's going to hurt. That's an irritant contact dermatitis from a hydrochloric acid. It happens to everybody. And allergic contact dermatitis, again, only about 20% of cases, does not happen to everybody. Not everybody's allergic to nickel, for example, right? Not everybody's allergic to poison ivy. Not everybody's allergic to fragrances in certain, soaps, cleansers, moisturizers, and things. But it can happen, and it can happen at any time. And this is another common thing that I have to help to explain to patients is just because you've been using a product for 10 years, 15 years, 6 months, 3 months, does not mean that you can't develop an allergy to it. It is truly something that's idiosyncratic. That's a big fancy medical word for we don't know why. It just happened. We don't know why. I use the example of my son. My son is allergic to amoxicillin, and he got it on the 4th round of amoxicillin. Why the 4th round? Why not the 2nd? Why not the 3rd? I don't know. It's just that's the random nature of it. Yep. But again, learning to spot those little fine differences is super important. And then, of course, we kind of can talk a little bit more in detail about the infectious side of things. Bacteria, bacterial pustules, we say, those typically are painful, very, very, very painful. And fungus usually doesn't have a lot of symptoms, interestingly enough. When I see a fungal overgrowth in the skin with tiny little pustules, we say, they oftentimes don't have a lot of symptoms. Sometimes they can be a little burny, a little bit irritated, but there really isn't a lot. There really isn't a lot there. So that's a quick little breakdown on not every blister is friction. So I want to make sure that message is clear to the audience.
No, and guys, this is something that I also hammer in a lot, and this is what will make me sound like a frustrated football fan yelling at my computer screen, is when I see online, especially, people posting pictures of what's going on with their skin and kind of looking for love in the wrong places in terms of getting advice from people who are not professionals, who are not clinicians, right? And then on top of that, in a picture, in this case, a picture is not worth 1,000 words, okay? I've worked in wound care for several years. I know Dr. Berrios has said he will forget more wound care than I will ever know. Okay? And the point is, you need somebody who has seen it before. You need somebody who's looking at it in person, someone who can kind of poke at it and touch it and do all that kind of gross stuff as a clinician, all right, to correctly identify it. And guys, I've been doing this for over 18 years. There are times where things come into my clinic and I go, I have no idea what I'm looking at. And the patient has never seen this on their skin before. And that's why we need to send them to the dermatologist. Okay. Now, for some of you who are much more experienced, have been amputees for years. Okay. Some of you might be prone to fungal infections. Some of you might be prone to a little bacterial infection. Some of you are prone to these things, and you know how to identify them because you've had them before in the past. And hopefully you know how to treat them. But my rule of thumb is the first time something pops up on your skin, get it checked out. Get it checked out. Okay. Get it identified. If you weren't wearing a prosthesis, maybe you could have a little bit more leeway and say, let me just watch it for a little bit. But the problem is whenever you have something on your skin that prevents you from using your prosthesis, that's going to impact your daily life. Okay. So it's worth getting it checked out, get it identified properly, because I know Dr. Berrios is going to agree with me when I say you don't treat a bacterial infection the same way you would treat a fungal infection, right?
Yeah.
And bad things can happen. Bad things can happen when you treat one with the other's remedy, right? Yeah. And it makes things go.
That's very true. And I'm reading Patrick's comment here about what's the pathophysiology of cellulitis. Well, so it's interesting you bring that up because that's when bacterial infections go way haywire. And again, getting to the point of early detection, early treatment. Cellulitis, Patrick, just to get to that question. Cellulitis is when a bacterial infection and its inflammatory response start to get into at least the second and maybe the third layer of the skin. So that's the true definition of cellulitis. Now, it doesn't have to be bacterial. There are many different causes of cellulitis, but by far the most common, north of 90%, is bacterial in nature.
It's staph, I think, right?
It's staph, absolutely.
Staph
aureus. Yep, exactly.
The most common one. And guys, I did a whole show. Like I said, there's so much we can talk about. I did a whole show on cellulitis and osteomyelitis because I see that a lot of folks use those terms interchangeably, but they're not the same. They're kind of sort of related, but they're not the same. So there's a whole show on that on the YouTube channel if you guys really want to dive into the differences between cellulitis and osteomyelitis. It's kind of my nerd thing. It's kind of really good stuff. All right, guys, these comments are amazing. I do want to say, guys, if I missed your question tonight or if I missed your comment, I will be going back to read them and I will make sure that we answer your questions. And also you all know that you can reach me on Facebook. You can reach me on my website. It's not hard to find me and I check my messages. So if I missed your question, feel free to send it to me again as well. Tom says, liquid powder has saved me from the summer heat issues. And living in Texas, I know that Tom knows all about that heat. Debbie says, I think I told Cosi before that my prosthetist took my leg from me because I overdid it at first. That tells me they care, although no fun having gym. Yeah, I used to have to play the Wicked Witch of the West too and take away my patients' legs, and they were not happy with me. But I knew that if I let them take their leg home, they would put it back on and let that blister keep reopening and reopening. I know it's got to be the tough clinician sometimes. All right, let me just kind of scroll through here. You know what? I think we need another giveaway. Who's ready for another giveaway? Got another giveaway? All right, guys, I am posting. There's the link. Woohoo, I did it. Okay, so guys, this link will take you to the testimonials of the Vital Fit web page. This is basically all the folks who love using Vital Fit, myself included. So click on this link and let me know what is the name of the first person who is listed on that testimonial. Hey, Harsh, glad you could join us. You're just in time for a giveaway. All right. Patrick says, signs and symptoms of cellulitis, shiny edema, shiny skin, edema, etc. No fever. Not always. Not always. Go ahead.
Teacher, can I?
Go.
I love this one. Okay, so there was a famous dermatologist in Harvard. His name is Dr. Haynes, and he came up with the famous Haynes triad. So Haynes triad is fever, pain / redness in the skin, and an elevated white count. Okay. So elevated white count for you guys, that's it's a blood test. You would have to go for blood work, and then that would show an elevated WBC or white blood cell count. Mm-hmm. So he famously said, you know, if you've got all three, you can be pretty confident that that's cellulitis. If you've got 2 out of 3, could still be. Mm-hmm. If you've got only 1 out of 3, patient don't have no cellulitis. So yeah, you know, we're taught to recognize the symptoms of inflammation, which is pain, redness, fever, you know, those things. That is all absolutely true. But when I've seen true cellulitis, the patient doesn't feel good. No, it doesn't feel good. Mm-mm. You know, yes, fortunately, the infection is still in the skin so far. But still, those things are traveling in your bloodstream. The patients feel sick. They know that something's not right. Mm-hmm. On top of the usual stuff, the area is warm. The area is painful. Typically, you can see it's what's called edematous. Edematous is a fancy word for swollen, thickened. And then you can feel that as you examine the patient and palpate it. Mm-hmm. But yeah, those are all the classic signs of cellulitis.
Absolutely. And guys, Harsh, you jumped in at the right time, buddy, and you've got it. It was Kay. Kay's on tonight, so we used you tonight for the giveaway, Kay. So Harsh, after the show is over, and Jeannie, same thing. Send me your address so that I can send you the travel size kit for Vital Fit, where you're going to receive the cleanser, daytime moisturizer, liquid to powder, and nighttime moisturizer. And I will add something to that, Dr. Berrios, with the cellulitis, because maybe it's just something in the water in my clinic. But so many times I will have a patient come in and they have this redness and it's kind of starting to get that little streaky look to it. They still don't have fever. And usually my patients will tell me, it's nothing because I don't have a fever yet. And it's just that red thing that goes off in my head going,
that's true.
We need to get you to a doctor, because if this is cellulitis, it's going to turn, and it's going to turn quick. And we actually had a viewer on the show who also did the same thing. She said, you know, got a little redness on my limb. I go check it out, because I'm not there to check it out for you. Sure enough, cellulitis. So guys, when in doubt, and this is a common theme through tonight, when in doubt, check it out, right?
Yeah, absolutely.
It's better to go to the ER and have the doctor tell you, yeah, nope, sorry, it's not redness, it's not cellulitis, you're good to go, versus waiting too long, right? Yeah. And having things go really south really quickly. Yep. All right, but again, cellulitis, whole different show. We got to go back to this show. Ready? All right. William says, had it many times, very sick. Hey, Pat. Oh my gosh. I'm so glad you're here, Pat. Patrick says, daughter has psoriasis, vital fit. She is being followed by PSDS dermatologist.
Peds dermatology. I think
okay, thank you. I'm not good.
Yeah.
Peds dermatologist. Okay,
Yeah.
Patrick, did you have a question? Let's see. So David says, I had vasculitis and the doctor wanted to amputate my surviving leg. I saved my leg, but they never found the cause. Now it's returned and it can be caused by being allergic to the silicone in my liner. So this is one of those cases, guys, where it's Dr. Berrios touched upon the dermatitis, right? So the irritation and infection of the skin. Is it from an irritant or allergic, right? And knowing the difference between the two. Now, it doesn't happen too often with my patients, but an allergy to silicone does pop up. Okay. And there was, I think, a question earlier. Kay kept saying that. Kay, was that you? Did you post a question that for whatever reason, whenever you get a new silicone liner, you have redness that just kind of shows up and you still haven't figured out why? Okay. So again, guys, this is one of those things where if you're wondering if you have a silicone allergy, get it checked out. That's probably the most common form of liner that is issued out to patients. And there are other options. So do you want to comment on silicone and the allergies to that sometimes?
Oh yeah, so it's very rare. Silicone is usually a pretty inert thing. And the reason for that is when in the production methods, this vulcanization that they do, which is the heating and all that stuff, the individual molecules are pretty bonded together.
Mm-hmm.
So it's hard to develop an allergy to something that's really bonded well. However, I've seen it. An easy way to test for this is what we call a use test. You do not need a dermatologist for this. If you've got an extra line or something that's lying around that you can chop up, maybe with Cosi's permission, if you could take some scissors, chop off a little piece, okay? Put it on a thin skin area of your body. Typically, I'll tell patients the inner arm. Hold on, let me flex.
Mm-hmm.
Ooh, yes.
The gun show. The gun show. The Tampa gun show.
No. They're in the shop. So hold on. Wait a minute. Here, like the inner part of this arm, and tape it and leave it on for 2-3 days and then take it off and then wait a week. If you develop an allergic reaction at the site of the use test here on the arm, then for me, that is a positive reaction. That's an easy way for you to do an at-home allergy test and come into me with that information. That's extraordinarily helpful. And then we can do some follow-up testing on that.
Mm-hmm.
So don't underestimate the use of the use test. Something that's a nice, and by the way, you could do this with anything. Let's say you suspect that you're allergic to one of the topical cleansers that you're using. Again, remember the symptoms: tiny little blisters, itchy, right? That should be the bing, bing, bing for allergic contact dermatitis. Do it on the arm. Just take a little bit, put it on another side of the body. It should be thin skin because it's easy to get a reaction there. Do it with a topical product. You should do it once to twice a day for 2 to 3 days, and then wait a week. And you should be able to watch out there and see if the reaction develops. If you are truly allergic, the reaction will develop there because the body doesn't care where it's coming into contact. An allergic contact dermatitis is not going to be isolated to a limb. It's going to be anywhere where that particular allergen touches the skin. So take advantage of that quick little tip.
So methinks that Kay, you're going to be trying this out because she was saying, she gets the redness, but then the redness goes away. So what does that mean? So I guess this is a really great little differential diagnosis for you, Kay, to give this a try. Okay. Mm-hmm. There was another one. There was one here by Teresa earlier on. And Teresa, you were mentioning about your concern as you get older and your skin gets more thin, with using the prosthesis and using the liner. I can tell you I've had patients as old as 96 using prosthetic devices and walking around very successfully. And again, for me as the PT, it's about teaching from early on skin care, skin health, skin protection. Okay. And then watching your body. Thankfully, we don't age 20 years overnight. Sometimes we feel like we do, but our skin doesn't just age 20 years overnight. So as the skin slowly, gradually changes, you will also be changing your skincare regimen as you get older. And we have now different liner options available. So if you find that your skin is extremely sensitive as you get older, you have options such as polyurethane liners that are really meant to help shuttle away the pressure. So you also have gel liners, lots of more options nowadays. days. So Dr. Berrios, what is something that you recommend as with the aging skin process for someone who's using a prosthesis?
And you bring up such an excellent point. This is something that I use in my clinical practice every day, explaining to patients that skin function is directly related to the aging process. Not just because we get older, although that is true. As we age, the skin does kind of dry out a little bit. It stops producing its natural oils as easily. Turnover process is a little different. But a common thing that patients don't think about is medications that come on board as we age that can also have implications for our skin's health. And the number one by far are statins. Okay. So for the audience, statins are drugs that are used to lower cholesterol. They work on the liver, and they stop the synthesis of some downstream things from cholesterol, and so it lowers your cholesterol that way. Well, guess what? One of the things that the skin needs to produce its own natural oils, its own function, is cholesterol. And statins don't just stop synthesis of cholesterol in the liver, they also impact the skin's own process of generating its own cholesterol. So the number one side effect from statins is dry skin. So as we're aging, as doctors say, oh, it's time to get on that statin drug, you're going to have to watch out particularly for the skin's health and see, are you developing new dry skin hotspots? Not just in the limb, but everywhere. Is the skin a little bit itchier than what it used to be? Am I noticing some flakiness, some ashiness, as they say, to the skin? And listen, I've had scenarios where the reactions, the dry skin reactions, have been so extreme, I guess, or so prolonged that it devolves not just dry skin, but into what we call xerotic eczema. So xerotic eczema is the itchy, rashy, extreme version of dry skin. And we've seen plenty of patients with it. And unfortunately, sometimes we do have to get on the phone with the primary and start to adjust those medications. Some other ones that come into mind are what are called calcium channel blockers. So calcium channel blockers are also used for control of blood pressure. And calcium is important for skin function. And we've seen lots of rashes from those. So we don't just throw everything into the aging bucket and say, okay, you're aging, that's what this is. Well, we have to look a more holistic approach, look at what else comes with aging. There's some medication changes there that you should look at and be mindful of. And I tell patients, listen, sometimes we're not going to necessarily figure out, this particular rash on the first go. I want you to go home and I want you to think about, when was it that you started lisinopril? When was it that you started, lovastatin? When was it that you started nifedipine? All of these different drugs, and create almost a journal in your mind. Oh, wait a minute. About 6 weeks after starting this medication is when this stuff started happening. So that can be very helpful. Just an interview with a doctor to say, okay, where is it that I need to be focusing? Where is it that I need to be thinking this through? And looking at medications is a very commonly overlooked one.
And guys, I'm like smiling because he's basically giving me plugs to all my greatest hits on the show. Okay? Huge show on pharmacology, guys, where we talked about the importance of reporting medications. As a physical therapist, I am not a doctor, okay? But I did have to learn just enough about pharmacology to understand the side effects and how they will affect my patient's balance, cognition during treatment, and identifying even sometimes when they're reaching toxic levels. And that's happened. Same thing with the dermatologist. And guys, I've been guilty. Sometimes I've been sitting in the dermatologist office, and just sitting there, why do I need to write my medications down? It's got nothing to do with, what's going on here and here and here. It does. Okay. Bottom line is, the more your doctor knows, the more your clinician knows, right? The more that they can help diagnose these things. And it's sometimes, like you said, hidden in those medications. And especially for those who are on pharmacies, right? By multiple doctors, right?
Yeah.
Listing everything down. You're going to be the one who may be the only one who knows all the medications you're on. So reporting that, kind of important. Yeah.
That's what I tell patients, Cosi. I am only as good as the information that I'm provided.
Yes.
Right?
Yes.
So give me good information. I've got a great computer in here. I've trained it. But you got to feed it good stuff. And then I can give you good stuff.
Yeah.
Yeah. So that's why I tell patients, give me good information.
This is good stuff. And I think Teresa's backing this up. Great information. We're so glad that you're here, Teresa. Let's see. Oh, Rasheen. Dude, there's my British. We've got UK listening in. So we have
UK.
Yeah.
What's up, babes?
Chimes in. Canada chimes in a lot too. So we got a nice little global audience. All right, guys. So here's the part where this is me on my soapbox that I will get on. And I know some of you have heard this part before, but it always is good to have it as a reminder, and you might get something new out of it. Prevention is key. Prevention is key. So guys, my patients come in, even if they have been amputees for years, I go over this with them, even if they're rolling their eyes at me because they already know how to do this. Okay. So taking care of your skin, guys, hugely important, but also taking care of your equipment, the stuff that you're putting onto your skin. Okay. I tell all of my patients, your body and your limb need to go into either a bath or shower at least once every 24 hours. Not wipies, not just a terry cloth. It needs to go in the shower. It needs to have water running over it once every 24 hours. Okay. And usually when I recommend to patients, if my patients come in and they say, I've been using this soap for 30 years, I refuse to change, it does nothing, it's fine with my body, I'll be the first one to say, I'm not going to mess with it. If your skin is fine and healthy, great. But the majority of my patients do come in with something or they're having trouble. Guys, for me, I've loved using the cleanser that VitalFit produces. It was specifically made for people who are diabetic and made for people who use prosthetic devices. What I like about it is you can use it on your skin, and you can also use it on your liner to clean your liner, and it does not degrade the integrity of the material of the liner. Some of the soaps that are out there nowadays are either harsh on your skin and they're also harsh on that liner. Okay. The other thing I tell my patients, because this happens a lot, sometimes my patients are over exuberant about their hygiene and they use a ton of soap, but then it makes it very difficult to rinse out. Okay. So that's something that I always stress the importance of. Use warm water and rinse, 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 and keep rinsing that liner and also your leg until that water runs clear, until you see no more soap suds. What happens is this soapy residue, right, will stick to the inside of your liner, right? And even though you may not have ever been allergic to soap, or you may not have ever been irritated with soap, what's going to happen, Dr. Berrios?
Yeah. Too much.
Too much,
Too
right?
much.
And it's going to get sitting on your skin and you're going to come in with an irritant dermatitis.
Absolutely right. That's
Yeah,
absolutely right.
and that's happened.
Yeah, no, and Cosi, you bring up another good point, which is that, and one of the reasons why I recommend, some of these advanced, more specific products is that they've done the research. They've done the product development to understand, what it takes to cleanse a limb, to cleanse a prosthesis, but not necessarily overdo it.
Yes.
And that's something we were talking about, Cosi, in pre. Bacterial balance on the skin is something that is poorly understood. We're taught by our parents, right? If it's not squeaky clean, it's not clean. Oh, wait a minute. Squeaky clean actually means that you've rubbed off all the natural oils of the skin. Not good. We talked about that.
Yep.
And you've probably decolonized the normal bacteria that's supposed to be on our skin. I forget how many trillion organisms there are in us, but I think there's more outside organisms on our skin than we have cells of our own body. That's how many bacteria we have on there. And that bacteria existing in balance is super important. We're learning more and more these days about what's called the microbiome. So the microbiome is this new and emerging field of medical research, which is the balance, the natural things that exist that are supposed to be there, and when that balance gets disrupted, what are some diseases that result from that? And there's some research to indicate that when the bacterial balance gets out of on the skin, when it gets out of balance, you can get things like folliculitis, which is infection of hair follicles. You can get things like eczema, and so you've got some researchers that are looking closely at how do we restore that balance. So bringing this back to that cleanser. Cleansing the skin appropriately and finding that balance between not overdoing it and allowing the skin to maintain that balance is super, super important. Like I was telling Cosi, there is such a thing as overdoing it. I tell this to patients all the time. There is such a thing as over cleansing. In acne, there is such a thing as over scrubbing, and you end up sometimes creating a worse situation. So absolutely, those specific cleansers have a really, really important role in management of particularly of these specific situations.
Yep. And my favorite thing is don't use a cannon to kill a mosquito, right? A lot of everybody, especially with everything going on with COVID, everybody is all antibacterial, but like Dr. Berrios just said, you're killing off the good guys too. And then when it does come time for the need to really use antibacterial because you have some sort of infection, because you're going in for surgery, for example, and you need to do a good cleansing of the skin, not going to be quite as effective, guys. So,
Yeah.
it's the Goldilocks, not too
Uh-huh.
much, not too little, just right. And I know I have an umbrella, just a general umbrella protocol. I need more coffee for my patients who come in. And again, these are for my patients who have closed skin, that they don't have any current issues with their skin. They just need to establish a nice skincare program. So, guys, for many years, I would recommend over-the-counter products for my patients. And, I was mentioning this to Dr. Berrios. I would recommend a lot of the products that I used to use for my burn trauma patients,
Hmm.
right?
Yeah.
A lot of the cocoa butters, a lot of the Cetaphils, a lot of the Aquaphors, things to really nourish and moisturize grafted skin. Okay. And it worked beautifully for my burn patients, but it didn't work so good for my amputee patients because, again, we're putting that garbage bag on top of the leg all day long. Okay. So for me, guys, when I started using the VitalFit products, I really like them because it does help with the control of sweat over time. So usually I tell my patients, start using the product for 2 weeks. And that's just me. That's just me. No research. That's just me with 18 years of experience, just saying, try this out for 2 weeks, see how your skin reacts to it. Okay. And I tell you the cleanser, the daytime moisturizer, the liquid to powder, and then the nighttime moisturizer when the skin is open to air and you're just kind of nourishing it back again. Okay. These products are meant to help control the sweat, help control the bacteria and the odor. After those 2 weeks, then I'll look at my patient's skin and say, okay, is that skin just a bit too greasy and we need to take out one of the moisturizers? Maybe you don't need the moisturizer, especially during summer months. Or the opposite, skin's a little bit dry. You can use a little bit more of that moisturizer and start to find that balance. And again, guys, this is a general umbrella protocol. If I have somebody come in who has, for example, psoriatic arthritis, I'm going to go follow what the dermatologist tells me to use. Okay.
Yeah.
So this is just a general protocol with these products, how to use them. Anything you want to add to that, Dr.
No, I was going to say, heading back to the first topic that we talked about, which was sweat and controlling sweat. I saw some comments roll through that some of your viewers have tried Botox. That's
Yes.
excellent. Botox is a wonderful. We typically, in our world, we think of it as second or maybe third line approach
Mm-hmm.
because it can be a little expensive for patients, and getting insurance to approve it is a bit of an uphill battle for us, at least in our experience. But Botox works wonderfully, and
Mm-hmm.
it can last 3 to 6 months. It is a series of injections. You do have to be willing to kind of sit through that, and that can be a little challenging for some patients. But it is a good option. Drysol, I saw Drysol come through. Drysol is
Mm-hmm.
excellent. Drysol is basically it's aluminum chloride, which is the same thing that's in deodorant. It's just a higher percentage. And I think it's in 20% solution. And what it does, the aluminum chloride forms clogs, little crystals inside the sweat ducts, and it literally blocks the production or the excretion of that sweat. So Drysol is a wonderful thing. You have to be careful how you use Drysol. Okay, this is again where a good provider really can make a difference.
Mm-hmm.
The number one reaction that we see with Drysol is an irritant contact dermatitis because the aluminum chloride complexes with water to form hydrochloric acid. What do we say happens with hydrochloric acid? An irritant contact dermatitis. So you really have to make sure you're putting on an absolutely bone dry surface. I
Mm-hmm.
tell patients, uh, you've dried your skin, think again, dry it again. And then when you think you've dried it, get a blow dryer and dry it again. Absolutely put it on an absolutely dry surface. But that's a great option. And then I think what's one of the things on the liquid to powder product that I particularly like is the starch component. It's got tapioca starch in there. Listen, if you want to dry something in dermatology, there's nothing better than a starch product to put it on there. That thing absorbs a crazy amount of water to dry weight content. So that is, I recommend that to all of my sweaty, complaining patients.
Mm-hmm.
Find a good product that has either cornstarch or tapioca starch. Those are wonderful at absorbing. So that's another really cool feature about this product. If you want to control absorption, I think the starch powder is a great option. If you want to go more on the production side, then you've got Drysol as an option. You've got Botox as an option. So those are all great things.
There you go, guys. And for those of you, the thing with the Drysol also to know, guys, especially if you're wearing a prosthesis, you can wear it if you have to put it on. Usually I tell folks also put it on at nighttime after your bath, after everything is dry, because it does take a little time for it to soak in. So in the morning, if you put it right, your liner right on, it might slip off just a little bit. Also with the liquid to powder lotion, especially what I love about this particular one, it doesn't get gummy. So you can keep reapplying it in thin layers throughout the day. Okay. And sometimes, for example, with my more sweaty runners, we'll do a combination. We'll do a deodorant and then we'll do the liquid to powder and hot spots to kind of just keep things going and keep things moving. Okay.
Yeah.
So, yeah.
Cosi, I totally agree. And the thing with the starch products, like you were saying, reapplying several times a day, I think is very important.
Yeah.
I think some patients, leave with the impression of, once application is fine. You really got to listen. You got to pay attention to the body and see how much sweat you're producing, what environment you're in, a work environment like we talked about earlier. So really paying attention, saying how much more do I need to put on, and feeling free to do that several times a day.
Yep. And then Tom says daytime moisturizer causes the conical liners to slide right off. And again, I do find that with some of my patients. Some of my patients will tell me, I feel like it's sliding off, and I check the liner, it fits okay. It's like, okay, let's back off on the moisturizer and use it the time at night. I'm a huge fan of moisturizers. So at nighttime to kind of restore that moisture, restore everything into the skin, and just kind of let the skin breathe just a little bit. All right, hang on. What do we got here? We've got so many comments here. I'm gonna have to really comb through this. When using the liquid, okay, so Linda's asking, when using the liquid to powder, do you cover the whole limb? So Linda, it depends. For people who have a lot of sweat, I will tell them, yes, put a thin layer over the entire limb. Obviously, you want to wait a couple minutes. It doesn't take very long with this product to wait until it dries into that thin, filmy powder, okay? If you find that you really don't need to use the powder throughout your whole limb, maybe you just have a few hot spots here and there, you can just apply it to the hot spots. I know several of my patients, they'll especially apply it to the top part of their liner where the brim is. That's where a lot of them will get a heat rash. So they'll apply it there, and that helps just the ring around, especially in the thigh area. Just helps kind of control that. Patrick, there's my physical therapist. Patrick reminding me to talk about daily inspection of the residual limb, morning and evening, and good skincare. Yes, thank you, Patrick. So going back to my diabetics, going back to my folks who have vascular issue, prevention. It's all about the inspection, especially those of you whose problems began with a simple paper cut with a little wound in the skin that you didn't notice because of the issues going on with the sensation in your skin. Okay, and this is something I used to do a lot when I worked in home health. I would teach the patient how to look at the entire part of their leg, the back part of the knee, in between the toes, underneath the foot, right? And if the patient wasn't able to cross their foot over and take a look, teaching the spouse, teaching the family member, providing a little mirror, right? That you can use to look at those places that you can't see, guys, okay? And addressing any paper cuts, any kind of abrasion to the skin before it gets out of hand, okay? Yeah. Yes, Grant, if you're using the liquid to powder, definitely need to wait for it to dry before you put it on. But like I said, it really doesn't take very long. In less than 2 minutes, it's completely dry. Okay, you guys are awesome. I'm going to post the last giveaway, and this last one is a good one. It's the full size cleanser, moisturizer, daytime, moisturizer, nighttime, and I don't have enough hands, liquid to powder lotion. Y'all ready? All right, ready? All right, I'm posting this one. So Vital Fit, and this is why it's my other handsome co-host, Dr. Berrios. It's my other handsome co-host.
Sorry.
Oh, I'm so sorry.
Just in case.
So, one of the reasons. You're killing me, dude. You're killing me. Kenny's like, woo-hoo. So guys, one of my favorite things about working with Vital Fit is they're not just about selling skin products. They're about trying to give back to the community. They're doing this with the blog that they put up there. They're also doing it with these fantastic webinars by this physical therapist I know who seems to think she knows what she's talking about. Okay. But I also have this amazing co-host. Okay. Twice a month, we have these webinars and we talk about all sorts of different educational topics. And I just posted the link there. I want you guys to tell me the name of my handsome co-host for the webinar, not my handsome co-host for tonight, my handsome co-host for the webinar, and tell me one thing about him. One thing about him. Go. I'm gonna make you guys work for this one. And I hope he's watching. I'm probably making him blush right now. What is the name of my handsome co-host? And you need to tell me one thing about him. We're getting a lot of answers, but they're not complete answers. Aha, Tom, yes. Yes, Tom, I'm going to brag. He has a skin fit socket. That's a good one, Kay. Look at you with your details. She was paying attention. Tom, you were the first quick draw McGraw. It is Greg Menino, and I'm going to brag a little bit about Greg. He is a prosthetist. He is an above-the-knee amputee. He is a 22-time Paralympian and Olympian.
Wow.
Downhill skier. Yeah, total bad, right?
Yes.
Amazing wealth of knowledge and just an all-around wonderful human being. So he is my co-host for these webinars that we do with Vital Fit, guys. You can check out the calendar for the webinars and how to register for them. They're free. Lots of giveaways on there too. So guys, I think, so Tom, please send me your address after the show is over so we can get you that full-size kit. Greg is my friend too, Johnny. He's a good guy. All right. Greg is like, why are people talking about me? So guys, I think we wrapped it up. We did it. And we stuck pretty well to the plan. I'm really proud of us.
That was good.
It was good.
Yes.
So guys, I do want to take this time to thank the fabulous Dr. Ricardo Berrios for taking the time from his very busy schedule to be with us tonight and giving us his wealth of knowledge. Thank you so much for being here tonight.
Thank you, Cosi. Thank you so much for the invitation. So honored to be here. Thank you guys for listening to me yap. I totally appreciate it. Can't wait to do it again.
And guys, thank you. A special thank you to my sponsor for this evening, Vital Fit. Guys, show them some love, please. The more you help my sponsors out, the more they can help the show out and the more information we can get out there. So guys, you can help my sponsor by visiting their website. Check out everything that they have. And don't forget, I got to do my plug. Discount code. Everybody loves a discount. I have 4 kids. I know I love me some discounts. So Cosi 10, guys. Cosi 10 gives you a nice discount. So you'll want to check that one out. All right, guys. Next week, Paralympics. Amplitude Magazine and I are teaming up, and we are talking about the Paralympics, and I cannot tell you how excited I am about that. So I want to see you guys here. Same bat time, same bat channel next week. Bye, guys. God bless.